Hello everyone, my name is Ebele Onyanusi. My presentation today is going to be on Innovation Project Video Proposal on Alive ECG. The medical application is Alive ECG. It is a medical application used by professionals in healthcare to analyze recorded ECG with Alive Core heart monitor and then transmitted to the appropriate physician for interpretation. It is a mobile application and works with compatible mobile devices. It has many advantages over conventional or standard 12-lead ECG electrodes. The problems the innovation will solve. Time. It takes little or no time to complete the recording and analysis of ECG. Atrial fibrillation. It has high sensitivity and specificity in detecting paroxysmal atrial fibrillation. Convenience. It is a mobile device which enables patients to conduct ECG tests anywhere and anytime without going to the clinic or hospital for the test. Communication. Alive ECG has made communication among care providers much better and has improved communication between care providers and patients. Cost of treatment. Cost of treatment is reduced because the patient does not have to visit the clinic or be admitted for every test. Background of the problem. Paroxysmal atrial fibrillation. It is the evasive problem Alive ECG is designed to solve. It is intermittent, therefore, the conventional 12-lead ECG cannot detect it most of the time. Heart failure. It is a complication of atrial fibrillation because it prevents the heart from pumping out enough blood. 50% of the affected individuals die after 5 years from the time of diagnosis. Cardiomyopathy. It's another complication of atrial fibrillation. The heart muscles become weak due to rapid beating. In patients with focal tachycardia, the incidence of atrial fibrillation-induced cardiomyopathy is about 8%. Research studies. Research studies conducted in the past was to compare mobile devices like Alive ECG with 12 ECG electrodes. Results confirmed that the sensitivity and accuracy of detecting atrial fibrillation are higher than the wearable devices such as Alive Core than with the conventional 12-lead ECG electrodes. Innovation collaboration. Collaborator A is a family nurse practitioner with 15 years nursing experience. She confirmed that the use of mobile devices such as Alive ECG makes communication between patients and healthcare professionals faster and better coordinated. She recognized the fact that the use of mobile devices such as smartphones, iPads has some risks, but Alive ECG has limited risks. Alive ECG takes about 30 seconds to record ECG. Therefore, it is the device of choice in an emergency, such in a patient with a heart failure. She collaborated improved accuracy of diagnosis because it can diagnose paroxysmal atrial fibrillation, usually missed by other standard ECG recording devices. There is easy sharing of data among professionals that provide care to the patients because of Alive ECG. Use of Alive ECG in the provision of healthcare has helped to promote coordination among care providers and the patients. Innovation collaboration. Collaborator continued. Collaborator B is a registered nurse with 25 years experience who has been the director of nursing for 10 years in a subacute facility in Los Angeles. She explained the importance of technology based on her experience at ICU, calling Alive ECG a life-saving. Besides, bedside ECG use improves patient care greatly because it can give access to patient information from different parts of the hospital. According to her, the use of this device can save costs as it can prevent admission and readmission. It makes care less stressful for the patients, family members, and healthcare professionals. Collaboration among healthcare providers is improved with the use of mobile device. Collaborator C. She is the administrator in a nursing home in the city of Los Angeles. She strongly believes that the use of Alive ECG can decongest nursing homes and still have patients managed properly and comfortably while at home. Physician does not have to be at the site where the ECG was recorded to interpret because it can be transmitted to him for interpretation. It is a useful tool to teach patients the steps and life choices that promote preventive healthcare. She believes that with continuous discussion and persuasion, everybody will appreciate the importance of innovation which will improve the quality of care or quality of patient care. Utilization of appropriate technology. Operation. The use of this mobile device is easy and fast. The user only needs to place 2 or more fingers on each of the electrodes of the Alive Core Heart monitor and have to maintain contact for about 30 seconds to avoid any interference from the ECG reading. The purpose. The purpose of this application is for adults who can use it at home and those considered to be high risk for atrial fibrillation, and also designed to detect abnormal heart rhythm. It is also for people who with congestive heart failure to monitor the heart rhythm, heart rate, and progress of the treatment. The platform use recording from Alive Core ECG can monitor imported into the platform use. Reading from the Alive Core monitor can be imported from Fusion's electronic health records platform with the reports and opinion of the experts within a few seconds. The physicians can retrieve information anytime. This will enable them make an informed decision about the patient's treatment plan. Problem solved. Accuracy. According to a research study, Alive ECG sensitivity is above 85% and specificity greater than 90% of the detecting atrial fibrillation after ablation. In comparison with the standard 12-lead ECG, this shows it has high reliability and accuracy rate. Time. Alive Core and Alive ECG take about 30 seconds to record and analyze ECG, compared to 12-lead ECG electrodes, which take 5 to 10 minutes. Convenience. Analyzed ECG recording can be transmitted to patient where he is so that he interprets it and sends the results back to the patient. Physicians does not have to be at the place where the ECG was recorded to interpret. Decongestion of health centers. Patients do not have to go to the clinic or be admitted for every test like ECG. It can be done with Alive ECG while the patient is at home. Cost of application. Compared to the importance of the functions Alive ECG performs. The device is cheap and affordable. The Alive Core monitor costs about $99, while Alive ECG application can be downloaded free. The payment can be made in a whole or part, or the payment can be made in a whole or in a monthly payment of $9.99 until it is paid off within 30-day free trial. Innovation solution. Features of innovation. It intends to promote quality of care and reduce its disparity using new products, systems, processes, policies, or structured organization. This mobile device is used to detect, manage, and monitor arrhythmias of the heart. It is well equipped to record and analyze the recorded ECG quickly. It can detect atrial fibrillation, which has proved evasive for the conventional 12-lead ECG electrodes, and can also detect high blood potassium level without invasive blood tests. Principles of innovation are curiosity, the modification of the task at hand with what has been observed. Role play. Individuals should be allowed to participate in the implementation of the innovation with the freedom of suggestion that will promote quality of care. Collaboration. Without collaboration, innovation cannot succeed. Healthcare providers must collaborate among themselves to promote innovation to improve the overall quality of the care. Diversity. Along the chain of the hierarchy of any facility, individuals should be allowed to provide their opinion on the care patients receive and how to improve them. Courage. This is the ability to do something one is not comfortable with or that frightens the individual. This is good for innovation, which requires the mind to take the first step that will that will that will lead to other discoveries. Momentum. It requires a continuous flow of ideas which are transformed into noble technologies that help the provision of better healthcare. Here are my references. Thank you for listening. Goodbye.